And welcome back, Asante Sana, for keeping it K24 this morning. A big thank you to, of course, Kiprono Kitoni for making a stopover on our up close and personal segment with Jeff Morte. We sure hope that you are enjoying the show. And if you are, why don't you let us know through our social media platforms at K24 TV on Instagram, Facebook, and Twitter. My name is Shiko Kaitani, and welcome to another session of our health and wellness segment. And today we focus on the national debate on the HPV vaccine. Now, the human papillomavirus vaccine that we all call HPV vaccine in short is a vaccine that helps protect you against certain types of HPV that can lead to cancer or genital warts. Now, it's said to be a game changer as far as the fight against cervical cancer is concerned, but still accompanied by lots of questions over the side effects this vaccination comes with. Is it safe? That's a big question. President Uhuru Kenyatta actually termed the vaccine rollout as a major milestone in the fight against non-communicable diseases. The Kenya Catholic Doctors Association, on the other hand, are calling for Kenyans to reject the vaccine. So where do we stand on this? Let's listen to the pros and the cons this morning. In just a few, I will be hearing from Dr. Stephen Karanja, who is the chair of the Kenya Catholic Doctors Association and a gynecologist as well. For now, though, let's catch up with Dr. Collins Tabu, who is the head of the National Vaccine Program at the Ministry of Health. He's at the far end. Karibu sana, Dr. Tabu. And then seated right next to me is Dr. Charles Morioki, not a stranger to the show. He is a gynecologist from MP Shah Hospital. Gentlemen, welcome.
Thank you.
So we have caught up with a number of Kenyans on the streets just to hear what they have to say about the HPV vaccination. And even on social media, we've gotten quite a number of questions and, just opinions in regards to this. You will be surprised, gentlemen, about the perception on this vaccination, even just what people generally think. So even as we start, I'm going to ask you to keep it as simple as possible so that everyone who is watching can actually understand. And so let's start from the ground, making our way up. Starting with you, Dr. Tabu, there is that misconception that, by the way, the HPV vaccine is here to cure all cancers.
No, that is not true.
Okay.
All right. Maybe first things first.
Yes.
The HPV vaccine is being introduced as a primary prevention for cervical cancer through preventing HPV infection. I would like to share with you, and just so you know, this is not the only, HPV infection is not the only virus that is linked to cancer.
Okay.
We have cancer of the liver that is linked to hepatitis B infection.
Yeah.
We also have Burkitt's lymphoma that also has a viral etiology to it.
Yeah.
So it is not the first one. Back to HPV infection, we do know for a fact that 99% of the cervical cancers that we have a direct link to HPV infection.
Yeah.
And just about two serotypes, two types of HPV viruses out of their 100 are responsible for about 70% of the cases of the cervical cancer that we see. Now, if we step back, we might just look at a statistic, but let's get to the numbers. Cervical cancer is a big burden. First of all, cancer is the third leading cause of death within our setup after infectious diseases and cardiovascular diseases.
Okay.
You step down and you realize that cervical cancer is the leading cause of deaths, cancer deaths among women in Kenya as we speak. Every day we lose 9 women from cervical cancer. That's one too many. Okay. So what the government is doing, and within the framework of the UHC agenda that we have and as launched by His Excellency the President, we're seeking to make to prevent or reduce the burden of cervical cancer within the community.
All right. Dr. Morioki, very quickly on trying to explain to our viewers about the correlation between what we're seeing, HPV, which is linked to sexually transmitted infections.
Yes, so thank you. HPV is the commonest sexually transmitted infection. Granted that actually the prevalence, basically how common it is in the society, depends on which society that you're talking about. But generally speaking, 90% of people who do get the HPV vaccine actually have it cleared from their system in 1 to 2 years. So it's in 10% of people where this HPV infection persists, and then it actually develops later on in life in the next 3 to 10 years to cervical cancer.
Right.
Yes.
Okay.
So HPV infection has actually been demonstrated by research to have what is called a cause and effect, in the sense that you can actually directly link the cause of the cervical cancer to this HPV from the results of the cancer testing done in the lab.
Okay, all right. So we actually mentioned at the beginning, or rather I did mention, that we managed to actually speak to Kenyans on the ground just to see how much we really do understand what this HPV vaccine is all about. So listen to what Kenyans had to say concerning this vaccination.
Mimi nimesikia na kupikia hapo sijaelewa, kwa maana sijaelewa vile mtoto mdogo kufikia huo umri wa miaka 8 10 kuendelea fenya anaweza akasaidiwa na hiyo chanjo. Sijaelewa kama hiyo kitu ni ukweli ama kuna jambo fiche serikali ambayo inaweza kuwa imeweka iko tofauti na fikra za wanadamu.
Kwa majina mimi naitwa Robert Kimilu. Naona hii issue ya HPV ni sawa, kwa sababu ukiangalia vile kansa imeweza kuathiri Kenya, itakuwa njia nzuri ya kupunguza. Asanteni.
Hii HPV issue mimi naona ni vizuri sana, sababu mtoto akishapimwa na akishapewa hiyo vaccine, kuna possibility ya kuwa kama hiyo kansa ingekam haitaweza kumpata. So itakuwa ni vizuri sana kama sisi tutakubali watoto wetu wasichana 10 years and for the 10 years people wapewe hiyo chanjo. I agree with it.
Kwa nini kwanza tusiwe na sure, tuwe na uhakika of what we are doing, isije tukafanya kitu baadaye kikaleta hata maambukizi mengine ambayo hatuyatarajii. Let's be sure of what we are doing.
Sasa ugonjwa wa kansa kwanza ni ugonjwa ambao unaua na hauna tiba. Kwa hivyo kwa vyovyote vile, kama chanjo inaweza kusaidia, hata kama itafanya kazi, lakini inaweza ikajaribiwa.
Sasa mimi nilikuwa naona, maoni yangu, kama hiyo shindano kwa watoto wa huo umri, naona kama haifai, kwa sababu wale umri wao ule ungali uko changa. Ni heri, mimi naona huenda inaweza kuwa kama ni family planning kwa wale wasichana, huenda wao wameona si chanjo, lakini hawataki kusema watu wajue. Ni ile mbao mambo kama wale wanachificha. Ndio hao wasichana kwa siku hizi wamekuwa wajuachi wakiwa wadogo. Ndio maana huenda.
And what do you have to say? As you can see, that is, a few members of the public down at the coast who we managed to speak to concerning the HPV vaccine. And so we're asking you the question of the day. Do you support the HPV vaccination? Do you support the HPV vaccination? Or you still have your reservations concerning this particular vaccine? And of course, talk to us on our social media platforms at K24 TV, on Instagram, Facebook, as well as Twitter. If you prefer to call, by the way, our lines are opened. Let's hear from you this morning and give us your thoughts. Now, looking at some of the stats, or at least some of the material that has been produced by CDC, Centers for Disease Control and Prevention, the HPV vaccine is routinely recommended for girls and boys ages between 11 or 12, although it can be given as early as 9. Now, it's ideal for girls and boys to receive the vaccine before they have had sexual contact and are exposed to HPV rather. And here in Kenya, the rollout is for 10-year-olds. The question, Dr. Muriuki, a lot of parents have is, who is this for? Are we talking about just sexually active children? Then I will now be taking my child to get the vaccination.
Thank you for that question. I think it's important to get that information out there in a way that Wanjiko would be able to understand.
Yeah. And
from the feedback we're getting is that there's still need for us to sensitize why this vaccine is being given to young girls. You need to understand that the immune response differs from age to age. And for this vaccine to have a good immune reaction that will give protection, it's usually given within those age ranges, 10 to 12, but even from 9 years, it can be given. It can also be given up till 15 years of age, and that will be 2 doses. But after 15 years of age, the CDC does recommend that it should be 3 doses, even up till age 26. Beyond 26, there is some benefit of giving the vaccine, but the immune reaction is not as good as in young girls. That is the reason why it's being given to girls of that age. Again, you also want to target them before they become sexually active, before they probably have potential exposure to HPV. Please remember that HPV vaccine not only confers benefit in terms of reducing the risk of cervical cancer, it does also reduce other risk of other cancers like vaginal cancer, penile cancer, head and neck cancers, and cancers of the anus. And this is important because in other countries actually do roll this program out to boys as well.
Right.
Yes, and there's also what we call herd immunity. Herd immunity means if 3 of us here are vaccinated against something like flu, the fact that 2 of you don't get it, and I'm not, vaccinated against or immunized against it, I cannot get it.
Okay. So when we actually talk about cervical cancer, Dr. Tabu, and we're talking about this going for young girls, parents would also wonder, okay, I have a son. Why are boys also receiving this vaccination?
Thank you. Thank you, Shiko, for this. Like my colleague Dr. Miroke said, the vaccine would benefit both boys and girls. But remember, in our context, as it were, we're introducing the vaccine as a primary prevention for cervical cancer. You would realize that boys probably don't have a cervix. But then again, they would benefit from the vaccine in terms of preventing warts and penile cancers and all that. But the burden due to these other problems is slightly much less. It's much less than the burden due to cervical cancer. So it is much more cost effective for the country than to target the girls with that kind of vaccination. Like Dr. Muriuke said, if we're able to protect the girls and get good enough coverage, we by extension end up protecting the boys. If we were not in a resource limited setting, then we'd probably aim to vaccinate both boys and girls. There are Western countries, European countries that are vaccinating both boys and girls. Argentina, Australia, for example, actually vaccinate routinely both boys and girls. They even have an expanded age range for vaccination. Okay.
All right, so now let's talk about where the issue is, about whether or not it's safe, because that's where we all at. And you would definitely agree with me, there's so much confusion out there, and parents are not able to make this decision as to whether or not, okay, fine, I'd be agreeing for my child to get vaccinated or not. So let's help parents today who are actually watching. And there was a presser actually released by the Kenya Catholic Doctors Association, quite a number of side effects that were listed, and I will actually be sharing that. But when you look at, for example, documentaries like The Sacrificial Virgins, and by the way, if you've got a device at home, whether you've got your phone there or whatever you have, go to YouTube and actually look for this documentary called Sacrificial Virgins that actually talks about the HPV vaccine causing neurological damage, especially because of the aluminium toxicity in it. And so I don't want to talk about the dizziness and the headaches and all that stuff that comes as a side effect. Let's talk about the adverse side effects here. This is where the issue, this is where we get deep, Thank you. So when you actually see people who are paralyzed from the neck down because of HPV, can you ignore that there are side effects to this?
So first of all, I'd like to say that would probably be a bit unfortunate. But I'd just like to say there's been those reports. They've been conclusively investigated. We have multiple studies within the US, Canada, and Denmark that have looked at all of these case reports, and there's so many, came with some of them I'll be able to share, that have actually exonerated the vaccine from those case reports. What we have is documentaries, is blog posts, which, sorry to say this, but is not researched, published literature. It's emotional pieces of literature that are out there in terms of documentaries.
Okay.
I would like to say this, that the vaccine is safe and effective against prevention of cervical cancer. And I would like to step back to a Kenyan context, as it were. The government, under the leadership of our CS, is not introducing a new vaccine.
Yeah.
You might want to know that the vaccine has actually been used within this country since the year 2007. In the year 2007, it was independently evaluated by the Pharmacy and Poisons Board.
Yeah.
It was licensed independently for use in Kenya.
Yeah.
It's been in use in private health facilities in the country since then.
Yeah.
We have not seen that, and Dr. Morioki might be able to confirm.
So now what we're seeing is just scaling up.
Yes,
Yeah.
number two. So what the government is doing, and they'll tell you, it's available in the private health facilities at a cost of between 8 to 10,000 Kenya shillings a dose. 2 doses, you need close to 20,000 Kenya shillings.
Yeah.
What the government is doing is making it more available to many more Kenyans who would otherwise not afford it.
Okay, so they're scaling up.
It's
Yeah.
scaling up. Number two, we didn't start this journey yesterday. This is a journey that began in 2012. And we consciously have two independent advisory groups to the ministry, comprised of various experts in fields of academia, research, vaccinology, and so forth, professors in their own right. We went through the advisory processes of the Kenya National Technical Advisory Group for Immunization. We also have a National Vaccine Safety Advisory Committee.
Okay.
So we went through that. And they gave a positive advisory opinion, and that's documented. In the year 2014 and 2015, we did a vaccination pilot to best in Kitui County,
Yes,
in which
I
we
saw
vaccinated
that, yeah.
22,500 girls, to best understand how to deliver this vaccine
And so far,
within the
no.
context
Yes.
of our routine immunization program.
Okay.
So far, there's been no issue.
Okay.
We've had looks through the scientific literature, and so far
Yeah.
there's no issue. As I speak today, ladies and gentlemen, we have 115 countries
Who have
using
endorsed,
this
yeah.
vaccine,
Right.
not endorsed, they're using it within the context of the routine immunization schedule.
Oh,
In
okay.
Africa, we have 16 countries. In the East African region, Kenya is coming in last to introduce this vaccine. A bit embarrassing, really, for us as a country that we really want to deliver new HC and be at the forefront towards cancer prevention.
Right.
But really, we come in last with
We're
the
coming in
preventive
last.
measures.
Okay, but if you look at where the Kenya Catholic KCDA are coming from, Dr. Morioki, they're saying that all this can be prevented if you just go for your regular pap smear. So it's not necessarily to get this vaccination. What we are doing, unfortunately, as Kenyans, is not taking advantage of the screening facilities and programs that are out there. Because if you manage to screen early enough, you can actually catch this thing. So there's no need of taking a chance on something which they considered is not 100% foolproof. Your thoughts?
Let me start by saying actually that in Africa, and it's an anthropologist who said this, that religion and culture is sometimes stronger than education and the knowing of what exactly is happening. And I think it's important for us to understand that we need to contextualize the burden of disease in our country. So it's estimated that 4,500 women are diagnosed with cancer every year in Kenya. And out of these, half will probably die from this disease. You're talking about 2,000, 2,500.
Right.
If you actually do the math, you're talking about 9 women per day.
Right, I did see that statistic.
Okay?
That is alarming.
So that is where we are coming from. And that is because probably we also have a higher burden of HIV in our context. And if you were to imagine losing 9 women every day, you would need to ask yourself what other thing can be done. Yes, pap smears have been done, and we still encourage that because the HPV vaccination is not eliminating the need for pap smears. But pap smears in itself, the uptake has been almost 15 to 20% in our context. If you ask many women, they may shy away from having a pap smear.
Right.
I think we need to understand that much as we are emphasizing on the need for
early screening,
for young girls and boys to probably think about delaying early onset of intercourse, because this is something that has been demonstrated and shown to increase the risk of cervical cancer. And actually, what my brothers would emphasize on chastity, I agree with them on that.
Yeah.
But what you're simply saying is, in and of itself, chastity and pap smears has not helped reduce this burden. So this HPV vaccination is actually an addition to the fuel that, chastity and, pap smear and screening would, do.
Sort of like complements their efforts.
So it's actually trying to help reduce the burden.
Okay.
Please remember, countries like Rwanda introduced HPV vaccine in 2010.
Or hence why you're saying we're really behind.
Yes, and actually our colleagues in Tanzania and Uganda also do have the HPV vaccination. If you were to sit down and say, can we evaluate the side effects that we're talking about? And actually, have they been documented to be as, what is out there? The internet age is good, but it also comes with its pros and cons.
Right.
I can post anything on the internet. And one of the challenges we have in this country is I can read a segment on one thing in one day, and the following day I'm an expert on it. Okay. I've come here to talk about the science of HPV vaccination. I may not be able to give you expert opinion on business. Okay.
Right.
And I'll stick to my lane. But what I'm simply saying is, before a vaccine is released, for instance, the Gardasil vaccine that is being used, 20,000 men and women, actually boys and girls, were actually vaccinated in what we call phase 1, 2, and 3 clinical trials.
Right.
These are randomized clinical trials, what we call the highest level of research evidence, okay? Such that we need to understand that before a product is released in the market, a lot of research has gone into it. Granted, the vaccine is not 100% effective.
Okay.
And it's not without other vaccines. Again, we are not saying that the vaccine does not have side effects. It does have side effects. But what we know is most of the side effects reported, and CDC did recommend and report this, is what we call minor side effects.
Minor, okay. So what we're talking about is a ratio situation. We're talking about like one person in like 1,000 cases.
You're actually talking about 1.7 persons, if you ever have a fraction of a person, per a million.
Oh,
That's what you're talking about. And just to touch on what he said, again, we do not take away our responsibility. Just like for the other vaccines, there's continued monitoring, mechanisms in place for continued monitoring and reporting on utilization and safety, just like other drugs and like other vaccines. And I'd just like to share something that might make people panic. Today, if you have the most commonly available drug, take out a packet of Panadol and pick an insert. The insert for Panadol places the responsibility of the manufacturer to list anything and everything that could potentially ever in the remotest of circumstances happen to you. That Panadol insert will actually tell you might actually collapse and die from taking the Panadol. But how much of us take it from the counter? Two, when you're talking about those other excipients, like you mentioned aluminum, Shiko, we have vaccines made from components of the virus that's actually disease-causing. It's more like training your body to be able to recognize the disease and be able to develop immunity to it. So we have components that are added to a vaccine to make it more effective. They're called adjuvants, and this is one of them is aluminum. And I'll share with you that the quantities that is there is in micrograms, very tiny levels. You probably consume more bigger grams of aluminum from the sufurias and everything else as we cook would probably all be brain dead or brain sick if we followed the aluminum story as it were.
And you know, I'm wondering, do you think that, in your opinion, Dr. Muriuki, that the HPV vaccine needs to be made mandatory? Because I think every era has their issue to deal with, their monster to deal with. You can't really call it a pandemic, I suppose, but it's been regarded as cancer is a disaster that is with us today. The same way back in the 80s and the 90s, it was HIV that we were tackling. Now it's cancer. Do you feel that this really needs to be made mandatory? Your quick thoughts before we take a commercial break on that. Let me start with you.
The vaccine is optional. I think it's important to remember, because these are young girls, 10 years of age, they don't have, legally they don't have the consent to give. That has to be done through their parents. But I think you need to contextualize what we're talking about. 9 women dying every day from cancer in our country. It's important to remember that these are our sisters and our mothers. The youngest patient I've seen and handled, with cervical cancer is 28 years of age. So 28 is really, really young, with a long life to this. And there's one I remember who was 34 years of age with cancer, diagnosed when she was in labor.
Oh, wow.
So here we are after delivery having to deal with cancer, and she has a small baby. So sometimes we like to dissociate, and we talk about figures that are out there, but you need to contextualize. Today, for instance, and this is where I get perturbed with Kenyans and their dissociation. There probably was a road accident somewhere along the way, maybe on Thika Highway. But that does not stop us from using matatus.
Yeah.
Okay, tomorrow we'll still use the same public vehicles. So sometimes we dissociate from the realities because we don't seem to see how it affects us. Treatment for cancer and cervical cancer is very, very expensive. Not only is it emotionally draining, economically draining, you also have many other people taking care of this patient. Stop what they're doing, economically viable activity to take care of this patient. So I think, yes, the vaccine should be encouraged. It's not mandatory, it's optional. People should actually go and interrogate this is what we're saying to get and see, is it actually true?
Okay.
I'd have really wanted this data about, you know, the 22,500 girls vaccinated in Kitui, for us to say what were the potential side effects. Did we do a surveillance, you know, for how many years have we done here, and a post-follow-up, so that we can say, we're not talking about studies that are done in the US and the UK. We're talking about studies that have been done here, right here at home.
Okay.
Yes.
As we go to a commercial break, yes.
Yeah, so Shiko, like my colleague said, we probably need to dissociate ourselves from some of these things.
Okay.
And as the Ministry of Health and under our leadership, we, beyond the individual getting vaccinated, we're considering the population. And like my colleague talked about, we're looking at, if you get as many people as possible vaccinated, you have what we call herd immunity. You're able to interrupt the transmission of a particular disease. So beyond you protecting yourselves, we're educating people because we want to engage them, have their concerns addressed so that you can get as many people vaccinated as possible and achieve that interruption of transmission of the disease. Like he said, we're not here to force people to get vaccinated. But we need to step a bit back and think about it. We're making decisions about our children who are minors and they may not be in a position to make a decision. Are we making the decision in the best interest of the child?
Right.
Number two, is the decision we are making on our own and our right to choose infringing on the next person by way of exposing the next person to some disease that would otherwise be preventable by us trying to exercise that right. So we need to put that into consideration and context.
And I guess we're also going to put that task the Ministry of Health to, you know, when we talk about sensitizing, are we doing enough on the ground? Because yes, you've come to K24, but that's just this morning.
Yes.
Where's the rollout?
Maybe I could mention one or two things about actually the reason why Rwanda has been so successful was that they actually started with sensitization and public participation prior to rolling out the vaccine.
Okay. All right. So that being said, we still want you to weigh in on this particular conversation. Do you support the HPV vaccination? That is our question to you this morning. Do you support the HPV vaccination? We're going to take a short commercial break. But even as you think about interacting with us this morning, remember there's no such thing as a silly question. And my teacher even told me that in primary, by the way. This is why we've got professionals here in studio so that they may answer your questions. So go ahead, talk to us on our social media platforms. Give us a call, if you will, and let's hear your voice this morning. We do have, of course, Dr. Charles Morioki still in the studio, Dr. Collins Tabu, who is the head of the National Vaccine Program from the Ministry of Health, right here in studio to answer some of your questions. So when we get back, we will be talking to the chair of the Kenya Catholic Doctors Association, Dr. Stephen Karanja, who is actually calling for this vaccination to come to an end. Okay.